All right. So we want to start out with just some quick introductions. So I'm joined today by Chris Richmond, who's going to be co-training with me. Chris, you want to introduce yourself?
Sure, happy to. Welcome, everybody. My name is Chris Richmond. I've been with ICF, over 24 years now, and before that I worked in local government in northern Illinois. Mostly at ICF I work with the home program. I've done a lot of training and developed some products for lead with the lead office, and more recently in the last couple of years starting with the revised Section 3 requirements and now home ARP. So glad you're all here today and learn more about lead. Thanks.
Great. Thanks, Chris. I'm Les Warner. I've worked with ICF for only 15 years at this point, and prior to that I worked at the state level. I headed up a state program, kind of worked my way up through the system there, was at the state level for 20 years. And work with CDBG, home, NSP, home ARP, kind of whatever comes along, but also have a background in Uniform Relocation Act, lead safe housing rule, and I'm also working on Section 3. We're really lucky today. We're joined by some HUD staff. We've got Bruce Haber and Barrett Fisher and Flora Chavez with us today, and they're going to be helping to field some of the questions as we go along. And we're encouraging folks, as Sharita mentioned, that as we go along, as you have questions, please go ahead and type those into the Q&A box, and we will, in some cases, we'll address them immediately typed. In other cases, we might interrupt and say, let's stop and explore that question a little bit. So let's talk about, as this was referenced, it's the start of a series, and actually it's 3 separate trainings, and we'll kind of talk through this a little bit. So the goals of this offering are to make sure that folks have a better understanding of the federal lead-based paint regulations, kind of introducing all of the terminology that you'll need to understand. And then because the lead safe housing rule has subparts that apply to some parts of the rule apply across the board, and we'll be explaining that. But then there are subparts that are specific to the type of activity that you're operating. And so we'll be looking at the series schedule here in just a moment and talking about the fact that, depending on the types of programs you're operating, you might only be interested in today's session, but you may want to attend other sessions based on the type of activities that you're responsible for. As part of this, we're going to be talking about, not only what the rule says, but how to put that into practice, and then talking about, key steps, the documentation that needs to be in place as part of that. And we'll also make sure that we point out there are a whole host of really good available resources that are online. And we'll spend a little bit of time getting you familiar with that, and I think you'll find that those will be very helpful for you going forward. So for today, we have 3 hours available to us. We may need all of that. We might end slightly earlier on that. And then tomorrow we have an hour, office hour set aside. So we're going to be providing you, as part of the packet that you got, there's an exercise that will put into practice some of the things that we're going to be talking about, so you can practice with that. And so in tomorrow's session, we'll start by going over that exercise, explaining the answers, making sure everybody is comfortable with that. But also, we'll spend some time answering any additional questions you have. And in preparation for tomorrow, Chris and I will also have gone over the questions that were asked today and look for some common questions, and we'll spend a little bit more time exploring those to make sure that everybody's really comfortable with the implications on what we're talking about and best practices on that. I will mention that each of these sessions is being recorded, and the links will be posted. And so if there's a scheduling conflict, that you still would have the ability to participate in sessions that you might have to miss the live presentation on. So today we're going to be covering Subpart M, which applies for tenant-based rental assistance, TBRA. Future sessions then are going to be covering Subpart H and Subpart L, which are in the coming weeks. Subpart H is specific to project-based assistance, and then Subpart L applies for public housing. So as I mentioned, depending on the types of activities that you and your staff might be working with, you may also want to attend some of the other sessions as part of this. Registration is separate for each of these sessions, and so you may have register for today's session, but you would have to separately register for other sessions that you wish to attend. All right. So you also got a number of, you got a link for handouts, and we'll be referring to some of these, or probably all of these as we go through this training. So we've given you sort of a cheat sheet on the lead-safe housing rule definitions, which may be very helpful to refer back to. Also the lead disclosure rule. And we're going to be talking a little bit later in today's session about the EPA's renovation, repair, and painting rule. And we've got a handout that not only explains that, but does a little bit of a side-by-side with the lead-safe housing rule versus the EPA rule on that. And then also a summary about lead-based paint. So we'll be referencing and showing a few of those as we go through this session. You might, if you have those printed out, you might want to have those handy. So since we're not able to be in a room together and kind of go through and do introductions, what we'd like to do is start out with a poll, just asking you about the background, your experience in working with the lead regulations. So Sharita has the poll open, and so we're asking how experienced are you with the lead regulations? And your options are, I'm new to applying the lead regulations, I have some experience, or I know how to perform all the key steps in that. So if you go ahead and mark your best answer on A, B, or C, and then hit the submit button, we'll roll those up and kind of take a look at the mix of folks that are participating in today's session. All right, the poll is ended, and it'll take just a little bit for those tabulations to show up for us. Should have those momentarily, I think. Here we go. So we've got kind of a nice mix. We've got a few folks that are really experienced with lead-based paint compliance, but a lot of folks who have some experience, and then quite a few folks that are new to this. So we're going to be covering all the basics, but kind of highlighting sort of how this is done and the appropriate documentation as part of that. So hopefully we'll answer all of your needs, your questions as we go along. But if not, we've got the Q&A box, and we encourage you to use that and also attend tomorrow's office hour session. So we're going to start out by just going through the lead-safe housing rule basics and make sure that everybody's familiar with that before we go into more of the activity-specific requirements under Subpart M. So I want to talk a little bit about lead and why, why we care about this, why this is a problem. So it's a naturally occurring element found in our environment. Some of that is naturally occurring, some of that is based on man's impact on that. So, because of it being incorporated into manufacturing, and also because of it was a component of fuel that was being used in transportation, we do have some lead that's found in our environment, but also in things like paint, in piping, in some ceramics. We also will have lead found, contamination maybe in soils. We also have some products that are used in households that might contain lead as part of this. So, lead's been with us for a long time. It was used prior to the 1800s. It was used as part of paint because it made the paint more durable. and helped as a drying agent as part of that. So it was also naturally resistant to mildew. So we particularly see it used in sort of those hard-working areas such as kitchens and bathrooms. It was banned in 1978, and as we go along, we'll be talking about units that are built prior to 1978, because that's prior to the banning of this, and so the likelihood of lead being found in those materials, so especially paint, is going to be more likely in prior to 1978. So next, let's talk a little bit about, so how does that impact people? Well, particularly, we have some high-risk groups. So children under the age of 6, their bodies are developing, and their bodies then absorb more lead, and they're more sensitive to the effects of lead than we generally see with adults. Most of that's something that's accidentally ingested, and we'll be talking about those sources of lead, such as chipping, peeling paint, but also dust that's being generated from friction surfaces, other sorts of contact. Also, we have to be concerned about pregnant women. And so a woman with an elevated blood lead level would be then passing that lead exposure on to that unborn child. And so we also have to be particularly concerned about pregnant women. And then, thirdly, we've got workers that, based on their occupation, based on the work that they're doing, have a higher level of exposure than you or I would normally have. And so we're going to be spending quite a bit of time talking about training for workers that are going to be working in these units when we've identified a potential lead hazard, and the protection in place to make sure not only that they are not being harmed by that exposure, but also trying to make sure that they're not then carrying that lead contamination with them back home and contaminating those environments also. So particularly with children, the way that they are getting that lead into their systems, children do a lot of hand-to-mouth action, and so that's a great potential. Children also oftentimes are going to be low to the ground. They're going to be crawling around on the floor, playing out in bare soil, and so they have more exposure to picking up that lead dust or other bits of peeling, chipping paint, and so they are more likely to have that exposure. And then lastly, in this same category, is, if we have chipping, peeling paint, we may have children that are eating those paint chips. I'm told that they have a little bit of a sweetness to them. I can't say that I've tried a paint chip for myself, but that can be attracting to a child who, is kind of fascinated by that paint chip and is going to ingest it. So when we talk about the triggering level for lead in a child, currently HUD is going to be using the trigger level of 5 micrograms of lead per deciliter of blood. So when we are testing a child and determining whether they are considered to have an elevated blood lead level, it's this 5 micrograms per lead per deciliter of blood. The CDC has adopted a slightly lower standard of 3.5. Currently, we are going to be working with the 5 micrograms per deciliter level, but we could see that change in the future. So some of the impacts from this exposure to lead can do things like reduce the child's IQ level or cause hearing or behavioral problems. It might cause learning disabilities for that child, but also, because we have these developing systems, could lead to some damage to nervous systems, kidneys, have an impact on bone growth and muscle growth on that. So all things that we really want to protect children from, if possible, particularly as providers of housing. We have an important role in trying to protect those factors that are related to those units that we have a role in providing. At the bottom of this slide, you'll see that there's a link to a little video, which I think would be really helpful if you haven't seen it before or you're trying to educate others about why lead is an issue that we need to care about. And it really takes you through the basic science of what lead is doing to the body. I found it very interesting, and I would recommend, if you haven't seen it yourself, that you use that link and take a look at that. So I want to talk a little bit about the lead-safe housing rule. So what this is doing is requiring that there be an evaluation of the property, and this applies for property owners, managers, particularly for tenant-based rental assistance. But depending on the level of assistance, the type of activity, and that's why we have different subparts that we're going to be going through, we will have different requirements on that. So essentially, we're trying to set some minimum federal standards in place. Keep in mind, you as part of your program design or local requirements might have a more stringent rule in place. We'll also be talking a little bit later that we have some states that it's a state-led program, and so we might see statewide regulations that have been applied that might be more stringent on that. And so we'll point that out a little bit later in this. So the rule that puts the lead-safe housing rule in place is the 1992 Rule Title 10, and then this is a section that authorized HUD to be able to put the lead-safe housing rules in place on that. And so the goal of this really is to protect children when they are in assisted housing, and it's primarily through prevention. So we're doing this evaluation and then trying to take appropriate steps to prevent possible harm to come from to those at high risk. And you'll see we're going to be following what the specific subpart will require, and for today that's specific to tenant-based rental assistance. So there are some exceptions for when this rule would be applied. And so I mentioned that the fact that the lead-safe housing rule went into place, or the ban on the use of lead went into place on January 1st of 1978. And so we have this exception that if we're dealing with a property that was constructed after that date, that property is going to be exempted from the lead-safe housing rule because it should not contain lead paint as part of that property. And so we'll be talking as you are implementing this, you may be asking as one of your initial questions, we're going to provide assistance to a unit in a property, when was this built, and then being able to determine, yes, we're going to apply the lead-safe housing rule, or no, this unit is actually exempt because of the date that that property was constructed. We also have an exception for 0-bedroom units, and then SROs, which are single-room occupancy. Now, the important thing on this is that that exemption is in place because the assumption is, based on that unit configuration, that we're not going to have children living in those units. So that exemption does not apply when we have a 0-bedroom unit or a single-room occupancy, an SRO, where there actually is a child under 6 that either resides in that unit or is expected to reside. And expected to reside means that we have signed a lease for a household that includes a child that is under the age of 6, or we have an expectant mother. And so we have a concrete reason for expecting that, yes, there is going to be an occupant that is under the age of 6, and so that exemption would go away. In the case where we have housing that is designated exclusively for the elderly, and I kind of want to spend a little more emphasis on this because we tend to have folks think about who's occupying the unit versus how that unit is designated. So this is housing that is set aside and restricted. So the only occupancy that is allowed would be for the elderly 62 years or older or persons with disabilities. And again, that exemption is based on the restriction on that occupancy. If we then end up having a unit, even though it was designated for the elderly, now maybe we have a grandchild that has moved in, that no longer will have that exemption because we now have a child under the age of 6 that actually resides or is expected to reside. And we also may have, and hopefully that number is growing in your community, properties that even though they were built prior to 1978 have been tested, found to be free of lead, or maybe they have had all of the lead-based paint removed and clearance have been achieved. So we will be looking as we analyze on assisted units whether they are we're going to need to implement the lead-safe housing rule. We would then need to know, is that property, when was it constructed? Is it restricted to a particular population? Is it a 0-bedroom or single-room occupancy, to be able to know what we would apply as part of that. Just save this. All right. So another exemption, and this is not something that you are going to, at least the first, is not something you're going to be dealing with under tenant-based rental assistance, but if you were dealing in, let's say, a rehabilitation program where you had an unoccupied property that was going to be demolished and it was going to be kept unoccupied, then we don't have to apply the lead-safe housing rule because that unit is simply being eliminated and we're not going to have that hazard. If we have an emergency action that needed to be taken, maybe we had a tornado and there was a portion of the roof that was missing, we could take that emergency action to stabilize that structure, and that would be exempt from the lead-safe housing rule. But that's to stabilize, not to do the restoration, the rehabilitation on that. So when we come back to do the actual rehabilitation on that damaged property, you would be following all the requirements under the lead-safe housing rule for the type of activity that you were undertaking. Probably not something they're going to be seeing with tenant-based rental assistance, but we want to make sure that folks have an understanding of this. Also, we have some limitations or some limited exemptions, I guess I should say, when the scale of the work that we are doing is really minimal. So we might have some kind of maintenance or repair activity that we weren't actually going to disturb any painted surfaces. Maybe we are replacing a water heater in that unit. We're not going to be disturbing any painted surfaces, and so we would be exempt from the lead-safe housing rule. We also, and again, we may not be dealing with this much under tenant-based rental assistance, but in cases where we are doing minor maintenance and we've got these very limited areas that we're working in, then we have de minimis levels. So if that work is less than 2 square feet of interior space, or 10% or less of a small component type, like maybe 10% of the woodwork in that unit, or 20 square feet of exterior work, those can be considered to be exempt under this de minimis rule. One thing I'll point out here and we'll be mentioning later is there are differences between the HUD de minimis levels and what are provided by the EPA rule. Essentially, the HUD rules are a little bit more stringent. All right, with that, I'm going to turn things over to Chris, and she's going to take you through the overall regulation itself.
Great, thanks, Les. Les is going to hand over, or can I grab it?
Get back to that screen. Sharita, you might be quicker and go. I have it.
Yep, there it is, now in the presenter. All right. So we're going to go over some of the regulations so you understand where the rule is coming from. There are actually two federal regulations that we're going to discuss today. The first is the HUD regulations. Those are found at 24 CFR Part 35. And then we have EPA's regulations, which are found at 40 CFR Part 745. And if you're new to this kind of regulations, the CFR stands for the Code of Federal Regulations. And we will always find HUD regulations at Title 24, and you will always find EPA regulations at Title 40. So to get started, we'll look at HUD's regulations. You'll see here we start off with Subpart A, and that's the HUD lead disclosure rule. And the Subpart A lead disclosure rule for HUD is actually identical. That's why you see that yellow arrow here, and I'll try to link those together. It's identical to EPA's Subpart F lead disclosure rule. So word for word, identical regulations there. Then we have our Subpart B for HUD. This is our general lead safe housing rule requirements and our definitions. And then we have our subparts of the different activities. And today we are going to be focusing on Subpart M for tenant-based rental assistance. And so this is going to be applied, like Les said, to any pre-78 housing that is federally assisted or federally owned. And then HUD regulations also follow Subpart R. Those are the methods and standards. And so this is where it covers what type of evaluation needs to happen, what kind of hazard reduction, if any deteriorated pain is found, how it's carried out, and who needs to do that. All that information is found in Subpart R. Then when we look down at the EPA regulations, as I mentioned, we have our disclosure rule, but then we have subparts D, L, and Q. This is lead-based paint activities rule. This provides standards and qualifications for carrying out the lead safe housing rule requirements, such as what kind of inspection needs to happen, how do you do a risk assessment, how if you decide to do abatement, how that would be done. So that's all found in D, L, and Q. And then the last subpart of the regulation that we'll be talking about quite a bit is E and Q, which is the renovation, repair, and painting rule. You'll hear Les and I refer to this as the RRP rule. So the RRP rule minimizes exposure to dust, and it emphasizes safe work practices. And we're going to go into a lot more detail about that as we go throughout the training. So on the previous slide, you saw the regulations. This slide really gives you a little more overview of what each one is. And all of these regulations are going to work together. So it's going to be really important for you to understand what they are. So we'll start off with the disclosure rule. This applies to almost all housing, both private and public, that's built before 1978. The disclosure rule has been in effect since March of 1996. And this is enforced by HUD, EPA, as well as the Department of Justice. Then we have HUD's lead safe housing rule, and this is applying to all federally assisted and federally owned housing built before 1978. This has been in effect since September of 2000 and is enforced by HUD and is solely focused on lead-based paint in housing. And then we have EPA's renovation, repair, and painting rule. This is the RRP rule. It applies to almost all target housing. And target housing, if you noticed on one of the earlier slides, is housing that's built before 1978. That's what that definition of target housing is. But EPA's rule applies to target housing as well as child-occupied facilities such as daycares and preschools. Different than HUD because HUD is solely focused on housing. The RRP rule it expands a little bit in addition to housing to also preschools and daycares. And this has been in effect 10 years after the lead safe housing rule came out. It's been in effect since April of 2010. And so any renovation or repair painting project that's done by a contractor that disturbs paint in a pre-1978 home or a child care or a preschool is covered under this RRP rule. It's enforced by EPA and it's also enforced by states. All right, so there are different sections of the regulations that this webinar is going to focus on. Today, we are really focusing on Subpart M, but we're also going to be talking about Subpart A. This is the disclosure rule, as well as B, some of the general requirements and definitions. Like we said, we're going to be focusing on Subpart M and then also talking about Subpart R as well. So tenant-based rental assistance programs comprise of federal rental assistance, and this rental assistance is tied to the tenant. So the tenant is able to take this voucher or the certificate to help pay for rental housing, and they usually choose where they're going to use that. So it's tied to the tenant. It's not actually tied to a specific location. And it allows eligible tenant families to identify and rent both publicly and privately owned housing. And at Congress's explicit direction to HUD, the requirements for Subpart M for tenant-based rental assistance are less stringent than what you would see for other programs, such as a project-based assistance program or public housing. So there are less stringent requirements for Subpart M than for other activities, and we'll go over what that is so that you're aware of that. Some of the programs that are administering tenant-based rental assistance, the biggest one that we see is the Section 8 Housing Choice Voucher Program. Those are Section 8 certificates and housing choice vouchers, the HOME program, Continuum of Care, HOPWA, Indian Housing Block Grant Program, as well as some ESG programs are also administering tenant-based rental assistance programs. So this is not an all-inclusive list. If you're not sure if your tenant-based rental assistance program funded with a program that may not be listed on here is following Subpart M, check with your HUD field office, check in with the HUD lead office, or put a question in here to the Q&A today if you're with us, and we'll be able to help answer that for you. If you are using your tenant-based rental assistance program and you're only paying for security deposits, you would be following Subpart K. Right, so if we're using it for rental assistance, we're following Subpart M. If you're using your TBRA funding for security deposits, you're going to follow Subpart K, and that follows acquisition, leasing, support of services, and operations. And so, no, I'm sorry, Subpart K. And so you want to make sure that you're following. If you are following Subpart K, then we did do some training, and that was done in June and July last summer, and so those are listed on the HUD Exchange. We also have a toolkit. We have a toolkit for M, but we also have a toolkit for Subpart K, and so you want to check that out as well. Okay, a couple key definitions that will help us as we go through some of this information. We already mentioned target housing, but that's housing built before 1978 with some exceptions. Remember, Les said housing exclusively for the elderly or housing exclusively for the disabled or 0-bedroom units unless a child under 6 is living in one of those. So that's target housing. We have lead-based paint hazards. And lead-based paint hazards are any conditions that cause exposure to lead from deteriorated lead-based paint or from dust with lead levels or from soil with lead levels above the hazard standard or from friction, impact, or chewable surfaces with lead-based paint and have dust lead that's causing a hazard. So it's any of these conditions that's causing exposure to lead that would result in an adverse health effect. Then we have lead-based paint, and lead-based paint is paint or other surface coatings that contain lead that are equal to or exceeding 1 milligram per square centimeter. There are some states and communities that have more stringent definitions of lead-based paint. Some of these states or cities have a more protective standard of what it considers lead-based paint. So currently HUD has set the limit at 1 milligram per square centimeter. Some other cities have it below that amount, so you should really check with your state and local regulatory authority to see if there are stricter requirements or definitions. And then we also have the definition handout. We did mention some of the handouts when we got started. This is the definition handout. It's a couple pages, 3 pages long. So if you're not familiar with some of these terms, that's a handout that you want to save, download, print out, so you can go back and access that. Get back to my slides. There we go. All right. So the Let's Safe Housing Rule also uses the term designated party. You hear this a lot more when we get into talking about the environmental flood level children, but the designated party is to identify the person or the entity that's responsible for responding to all Let's Safe Housing Rule requirements for a particular housing property or unit. So for Subpart M, the designated party could be the owner, it could be the grantee. When we're dealing with housing choice vouchers, that grantee could also be the public housing authority. It just depends on what the step is and what needs to happen as to who is paying for what. And we do have a slide in a couple minutes that does provide that breakdown a little better for you. There's also many professionals that are involved with housing and tenant-based rental assistance and helping to meet compliance with the Let's Safe Housing Rule. So we start off, we have our owners and our managers. This could also include in-house inspectors and maintenance personnel, also repair contractors, someone doing the renter intake. We might have program staff. This is your grantee or your public housing authority. Again, intake staff, your inspector who would be trained as a risk assessor. You have compliance staff, your finance staff, and then you may need to call upon lead specialists. So if there is deteriorated paint that needs to be stabilized, you would need to hire someone trained in RRP. It's usually the owner that would hire somebody trained in RRP to do that work. They would have to have a clearance done. That clearance could be done by a risk assessor, a lead inspector, or a clearance examiner. So lots of different actors involved in this. As we go throughout the training, some of these terms are going to become a little more familiar to you. When I talked about clearance, you're like, Chris, I don't even know what clearance is yet. Who does that? We're going to talk more in detail about what all these steps are. So hang in there. The property manager, so we did want to let you know in 2021, so a couple years ago, EPA did announce that its intent to improve compliance and strengthen enforcement of the RRP rule. That's that renovation, repair, and painting rule as it applies to property management firms and companies. So the EPA rule is now enforced for property managers, even if they are contracting out maintenance duties. It does follow out to that as well, because we need to make sure that any type of maintenance is being done, if it's above the de minimis level, that it's being done by someone who's trained properly, and for TBRA, that would be someone who's been trained with RRP. We do provide the link here if you did want to read the EPA announcement. So this slide really just gives you an overview of the summary for TBRA. And the next slide I have is the same information in a chart form. But first we're going to start off on the left side here. We have our disclosure. And so disclosure for tenant-based rental assistance applies regardless of whether there's a child under 6 living in the unit or not. So we always have to apply disclosure for tenant-based rental assistance activities. And this is where the owner is going to disclose any known lead-based paint hazards and reports. They're going to give the pamphlet, the Protect Your Family from Lead in Your Home. This is going to be done before lease or at lease signing. Any information known about the unit if there's lead, or even if there's no known information, is going to be shared. That's all part of disclosure. And then the rest of the steps here, these steps here, I'm going to draw a little line. To the right of look and moving over, these only apply for tenant-based rental assistance if there's a child under the age of 6 living in the unit or expected to reside in the unit. So remember I said that Congress wanted the HUD office to not have the lead rules be as stringent for TBRA as they are for other programs. And this is the effects that you see for that. So looking, treating, clearing, all these other things, all these other parts of the lead safe housing rule only apply for tenant-based rental assistance if there's a child under 6 living in the unit or expected to live in the unit. So if that's the case, if most of our projects do have children under 6 living in them, first we're going to be looking. So that's we're using a visual assessment to try to look for any deteriorated paint. If we identify any deteriorated paint, if we see those hazards, then we're going to be using paint stabilization. After the work has been done using properly trained RRP workers, then that work needs to be cleared by, it's called a clearance exam, and this is done performing both visually and dust sampling. And then we need to be telling, so we need to be notifying our residents about what was found, what kind of work was done, how that was treated, how it was cleared, and then the unit needs to be maintained. So there are ongoing requirements because there is an ongoing relationship between the funding source of the program and the unit. So we have this ongoing maintenance requirements. And we are going to go into more detail about what the steps are for each of those as well. This is the lead-based paint summary for tenant-based rental assistance. And you'll see at the top we have disclosure. Disclosure, again, always required regardless of the occupancy. And then the rest of the requirements down here only apply if there's a child under 6 living in the unit. So we have our looking, we talked about our visual assessment, we have our treating, we're doing paint stabilization, here's where we're talking about our clearance, we have our ongoing maintenance. Here we have EBLL, it stands for elevated blood lead level requirements. So if there's a child identified with an elevated blood lead level, there are certain requirements that need to be put in place. There's a very tight time frame. We have 1 or 2 slides in this training that talks about this. Les and I did train about elevated blood lead levels for Subpart M in December, so that's been recorded and posted, so please go back and look at that later. Okay, everybody always asks who needs to pay for what, and so the responsibilities of who's paying for what, the grantee, or who also might be the public housing authority, they're the ones paying for the initial visual assessment. If there's an elevated blood level child, they're paying for the risk assessment, which would also be an environmental investigation. They're paying for clearance and then any periodic re-inspections. And then the owner is paying for any paint stabilization that might need to occur, if there's any lead hazard reduction activities that have to occur, as well as ongoing maintenance. So Les, is there any questions that have come up before I dive into disclosure?
We've had a couple of questions. They were asking about the qualifications and training for a risk assessor, and we're going to be dealing with that a little bit later today. There was a question asking if they had a property that included multiple bedroom units, but also included some 0 or single room occupancy units, how they would apply the exemption. And I explained that they would need to apply that based on the unit type and those particular criteria, but keeping in mind, if we have a child under the age of 6, that exemption goes away on that.
Great.
And we had a question, which, Chris, I'm not completely sure on. There was a question, let me go back to this, for a rapid rehousing program. This was, I asked a few more questions, and this was This was providing funding on an ongoing basis, and it's up to 6 months of rent. I know in some of our programs we have an exemption that applies when that assistance does not exceed 100 days, but I think those have been done on a program basis. For instance, under the COVID funding, that has been in place. So I suggested that they check not only the program regulations, but also with their HUD field office. I don't know if you have any additional guidance on that one.
I don't, unless Bruce or another HUD staff might be able to help us out right now. I'm not sure.
Yeah, this is Bruce, and yeah, it's continuum of care. Rapid rehousing is always kind of complicated because it's covered under Subpart K, not Subpart M. And there is a big difference, too, if it's a longer-term assistance, such as, it's going on for a couple of years, then it'd be typically funded under Subpart M, which means the lead-safe housing rule would apply, and it only applies when there's a child under the age of 6. Now, if it's a shorter-term assistance and it's Subpart K under the leasing programs, there is no child under 6 designation. So the Let's Safe Housing Rule, the requirement for the visual assessment, I don't remember if you've talked about that yet or not. The visual assessment is done regardless of the presence of a child under 6. So you don't have that limiting factor under Subpart K that you do under Subpart M, which is what makes it sometimes complicated to try to really interpret it correctly for your particular program. And you can always reach out to us through lead regulations at HUD.gov email for a much more detailed analysis and conversation to go over your particular project.
Great. All right. Anything else left, or should I dive into disclosure?
I think you can move on.
Okay, great, thank you. All right, so we're going to talk a little bit about disclosures. The disclosure rule applies when selling or leasing a unit, and we are focusing on leasing during this training session. So the property owner is required to disclose any knowledge of all known lead-based paint when the owner sells or rents the home or unit. So we're going to provide you with a really brief overview of disclosure. So we do have a handout. Here's my lead disclosure handout. So if you are new to housing, or your boss decided this is something you're responsible for now and you don't know that much about disclosure, there is a handout that we've provided, and it does provide some background information for you about where the lead disclosure rule came from. It has been in place since 1996, and the purpose is to provide information about lead-based paint and lead-based paint hazards. And so the owner discloses any known lead-based paint hazards. It also provides any records and reports that would accompany that, as well as if they don't know if there's any lead in the unit or not. And so this is for the unit and any common areas that are servicing that unit. So common areas, some examples might be a hallway, a laundry room, perhaps a garage, and exterior surfaces of the building. So this applies to almost all pre-1978 for sale and rental units. The owner or the lessor is going to provide the pamphlet, and this is what we mean by the pamphlet. That blue protects your family from lead in your home. It is available in several different languages. You can access that from both HUD and EPA's website. So they're going to provide that pamphlet, and then they're going to provide the disclosure notice that's providing that warning statement, and then that includes disclosing whether any known or unknown information. And this needs to be done before the contract is signed. So if the owner is, or the landlord is renewing a lease, and the owner has new information about lead-based paint and lead-based paint hazards, they would need to provide a new updated disclosure notice to the tenants as well. So there are a couple instances where the disclosure would be exempt. This is found at 24 CFR 35.82. The two that are most relevant are the ones in the green circles for tenant-based rental assistance. So there perhaps might be a unit that was, or a property that's found to be lead-based paint free by a certified inspector. So this would be under a federal certification program or under a federally accredited state or tribal certification program that the property is lead-free. So if it's lead-free, then it's exempt from having to do disclosure. Or the rental of an existing lease in target housing, that's the housing built before 1978, where there has not been anything that's changed. So the person moved in last year, they were provided with the disclosure notice, another year has passed and they're renewing their lease. There has been no new information as it relates to lead or lead hazards. The owner does not need to give another disclosure notice. So that's what that second circle here, previously disclosed. So if we've already provided a disclosure notice and nothing has changed, we do not need to provide another notice. Right. You want to make sure that your program and your landlords that you're working with are using the correct notice. The watch out for lead poisoning, the paint poisoning that you see on your screen here is the incorrect notice. The correct notice is on the next slide here. This is the disclosure of information on lead-based paint and lead-based paint hazards. This is found on both HUD and EPA's website. As I mentioned, there is one for sale properties as well as for rental housing. You want to make sure you get the rental housing one. And make sure you are using the correct notice. There are 10 different areas that are subject to violations per notice. And each violation is about $19,000. So if you multiply $19,000 times 10, it's $190,000 of penalties per lease transaction. So please make sure that your landlords and your program are using the correct disclosure notice. This is available on HUD's website, on EPA's website. And then if you are working in Massachusetts, Rhode Island, or DC, there are modified elements of the form, and so you want to reach out to your state authorities and make sure that you have the correct modified elements for that form for the disclosure notice if you are working in Massachusetts, Rhode Island, or DC. So there are sections that are often completed incorrectly. Some of the most common issues that are seen, one is timing, where the disclosure is sometimes given after the contract or the lease has been signed. It is required that disclosure notice be given before the lease is signed or the contract is signed. So that timing is often an issue. Make sure it's being provided before the lease is being signed. HUD has also seen a lot of fraudulent signatures. Sometimes the owner signs for the renter or tenant. We need to make sure the tenant understands what the information they're being provided and that they are the ones signing where it says renter initials. And then also there's a lot of issues where information is just not disclosed. It's not being filled out properly. There's reports are not being attached. So make sure that you're trying to avoid some of these common violations. Okay, it's also important for programs and owners to be aware of when children under 6 are residing in the unit. This information is often gathered at the application stage and at lease renewal, and it's really going to help you implement protocols if an elevated blood lead level child is identified, and we'll talk a little more about that later. But it is responsible, the owner is responsible for identifying if there's any children in the unit. And then we have provided a resource here that can be used to help track that. And then the grantee is also responsible for reporting. We'll talk about that in a slide or two. But they are there is a lot of ongoing maintenance requirements the landlord's responsible for, and it's helpful, excuse me, for tenants to understand how to live safely in a pre-78 unit, because most of these units are not lead-free. They've been treated to be lead-safe. But there are a lot of things that would be helpful for the tenant to understand. And so we want our landlords to be able to educate our tenants to look out for deteriorated paint. And so they're required, the landlord is required to instruct tenants to inform them if any deteriorated paint is occurring in the unit or the common areas. Like I said, those common areas are hallways, laundry rooms, play areas, exterior surfaces of the building. And that deteriorated paint, that's that peeling, chipping, flaking paint. It's perhaps paint that's being rubbed off by friction or impact surfaces, such as the door jamb opening and closing, or maybe the windows opening and closing. It also includes painted surfaces that are damaged by water. I live in Virginia, and it's been raining for days on end. So I'm sure some of these houses are having some water damage. So water damage is also a cause of deteriorated paint, or damp surfaces that can cause deteriorated paint. So we want our tenants to be able to notify the landlords when they see any deteriorated paint that might be occurring in their units. Also want to encourage the tenants to retain that Protect Your Family from Lead in Your Home. That's that blue pamphlet that comes in multiple languages that also provides some tips on how to do some general housekeeping, how to wipe things down to keep dust down to a certain safe level. And then again, here's another resource that's provided to you. That's from our toolkit to help track occupants. All right, so here I mentioned that the grantee is responsible for identifying children living in units. The reason is because they are required to coordinate with the health department on a quarterly basis. And so there are two different ways that a program running a tenant-based rental assistance program can do this. They can request the addresses of children with elevated blood levels from the local or state health department. We do provide a sample letter through our toolkit if you want to access that. Or the most common that we see is the program itself providing the addresses to the health department, the local or state health department, that says, here's the 25 units that we're providing tenant-based rental assistance to. Please compare these addresses to any addresses where you might have found a child with an elevated blood level residing. And so if that happens, if there's a match, there are special steps that have to be taken when a child with an elevated blood level has been verified. And we'll go over different steps with that. But the second option here, we do have a sample letter for that as well. This is more common because it's unlikely that the state or the health department is going to just hand out information about children with elevated blood levels, but you do have to have some type of process in place, and I highly recommend maybe having a memorandum of understanding, something signed in your files so that HUD can see that you are attempting to share this information with your local health departments. But like I said, this one is the one that's more commonly used across the country. So this is you're going to start to see these documentation slides as we go throughout the webinar. And so talking about disclosure, what's the documentation we need to have? Well, we need to have that, the owner needs to have that disclosure form, and you want to check to make sure that there's proper signatures, that they're using the proper form, that there has been tenant instructions provided about reporting deteriorated paint, that there's information being collected about children under the age of 6 residing in your tenant-based rental assistance units, and that there is some process and documentation in place that there has been communication on a quarterly basis with your local or state health department, notifying the health department about any units that you are providing tenant-based rental assistance funding to that have children under the age of 6 residing in them. So let's do a quick knowledge check. This is going to come up as a poll for you. So true or false? At lease renewal, the owner needs to provide the disclosure notice again to the tenant. There has not been any changes to the household or the unit. So is this true or false? What do you think? All right, the poll has ended. Let's see how everybody did. Okay, well, it's about 2/3 of you got the correct answer. So the correct answer is false, right? So if nothing has changed to the unit, then you do not need to provide a new disclosure notice at lease renewal. So we have to look at the clues in the question here. There has not been any changes, and we are at lease renewal. So we do not need to provide another disclosure notice because nothing has changed. It would be exactly the same information that was provided when they moved in. All right, Les, I think I need to hand it over to you.
Thank you. Let's see if that, give us a moment while we change presenter. There we go, all set. All right, so Chris has been talking about the disclosure part of this, and then we're going to move into talking about the evaluation of the lead-based paint hazards on this. And I'll just mention we are going to take a break in just about 13 slides, which I think will put us at probably roughly the halfway point here. So we will have a 10-minute break coming up just about the time you probably need it. All right, so when we're doing our lead-based paint evaluation, it's going to depend, again, on the subpart that we are following and the type of activity that we're going to be undertaking. But those options include the least of these is what we're going to be doing for tenant-based rental assistance is a visual assessment. And so an inspector that has some training is going to be doing a visual inspection and looking for any signs of deteriorated paint or paint chips, dust, or other debris. For some of our activities, it will require, or some of the subparts will require a lead-based paint inspection. And so instead of just looking for deteriorated paint, this is going to be determining whether we have lead-based paint there or not. And so generally we're going to be using an XRF analyzer, and we'll look at that in just a little bit on this, or we could be removing samples and sending them off to a lab. And then really our highest level of evaluation is a risk assessment. So not only are we identifying where there is lead-based paint, but also doing some sampling of all of our deteriorated paint, dust. One thing we'll note is this does not include, the lead safe housing rule does not include water as one of the things that needs to be tested. That's something that would be optional, and you as a state or as a grantee may have said, well, I'm going to include that in that, but that is something that is optional. If the water is tested and lead appears, then there are a number of ways to address that. Some of that might be because of piping in the unit. but it also could be related to the water delivery service. And so testing and reduction strategies are going to vary across the country. And obviously we've heard some examples in communities where this is a real issue for them. So specific to tenant-based rental assistance and Subpart M, which is what we're focusing on today, what's going to be required is a visual assessment, and that needs to be done at unit turnover. So every time that before we rent that unit, we're going to be completing that visual assessment, looking for any signs of deteriorated paint or dust or debris as part of that. When we're doing, as part of our ongoing maintenance, we're also going to be doing an annual visual assessment. And so anytime we have a unit turnover, but also on an annual basis, we're going to be doing that visual assessment. And so that visual assessment needs to be completed by a staff person, or it could be a contractor, that has received training and has a certification in place. Now, the good news on this is that this is a free online training. So we've provided the linkage for that training and certification process. So we might have a property manager or maybe a maintenance staff person that has taken that training, has the certification, and they would be able to complete that visual assessment at turnover and the annual review that needs to be done. You know, the other option is obviously to contract that out, but this is something that probably could be completed by staff with the appropriate free training. One of the resources, I'll just point out this bottom point on the slide. Within the toolkit, there is a log to be able to be used. So as you are completing that visual assessment, you will be able to record that your process, each of the spaces that have been inspected, and then what the outcomes were on that. So you had to have a record of that work being completed. That would also then give you a record for if there was any corrections that needed to be made. You would clearly have identified where those were located, and that would be the starting point in getting that work completed. So any time that we identify where we do have, based on that visual assessment, that we do have hazards in that unit, then we would need to be using an appropriate firm or individual that had the licensing and certification in place. And so depending on the subpart that we were operating under and what those requirements were, we might be contracting out for a risk assessment, paint inspections, clearance testing, and kind of generally it may be a combination of those depending on the kind of activities that we were doing. So we provided you a number of resources here. There's a link for the HUD guidelines that specifically call out what those requirements would be. And we've also got a handout. There's a handout that walks through the worker qualifications that are required, and also providing some linkages on that. So that's one of the handouts that was provided to you. And then we mentioned that in some cases, you know, for things like visual assessment, you might be having your own staff take that training. But if we're going to be hiring someone, there are resources from the EPA on identifying where there are certified renovation firms or training providers that are in your area, and so we provided a link for that. And then as Chris mentioned, we do have states that are operating their own renovate repair program, and so we have a link for those programs that I think was provided on the earlier slide. We'll also just mention, in your area, if you have CDBG and home grantees that are currently running programs such as homeowner rehabilitation programs, rental rehabilitation programs, they may already have a list of contractors that are working with those programs, so they may be able to provide you a list. Many of the times you'll have an approved contractor list, so they've already verified that initial screening to make sure that they have appropriate training and certification. And then this last resource here, across the country we have lead hazard control grantees that have received funding from HUD to undertake lead hazard reduction activities. And so they would be actively working, would have most likely engaged renovation firms in the area, and would again be able to provide referrals to firms that are working within your area. You know, one of the things that you would need to make sure if you were going to issue an RFP or an RFQ, that you specifically call out what the licensure and certification requirements are going to be for that particular job, and that would be included in your evaluation criteria for, you know, how you would evaluate bids and select the bidder on that. So make sure that, you know, those packets that you might be using for RFPs or RFQs have been updated based on the subpart that you are following and those specific requirements. We also wanted to show you or highlight on the EPA site, they do have a way to be able to search based on your area. So you can put in your zip code or the town and state, and then search based on a distance that's been put in place, and that would identify either firms that are licensed and trained to do renovation, or if you needed a sample, a dust sampling technician as part of your clearance process. So we've provided a link here, and this would be a way to start that process if you needed to, on identifying, you know, what's the supply of certified firms in my area, and begin that outreach, and that might be part of issuing an RFQ or an RFP as part of that. So for tenant-based rental assistance under Subpart M, our requirement for evaluation is going to be a visual assessment. So this is an inspection that's completed by a trained person, and they're simply going to be going through that unit. We mentioned about using the log as being able to record that process. They're going to be looking for any sign of deteriorated paint or paint chips, you know, unstable painted surfaces, dust, or other debris that may present a lead hazard. Now, we're not actually testing to determine if this is lead paint. You could choose as a program to do paint testing on that, but visual assessment is not requiring this for the tenant-based rental assistance portion of that. So then based on that visual assessment, we would then be making sure that corrective action was made, and we'll be talking about that. So our visual assessment, again, needs to be completed by someone who is certified, so you would have that documentation in your file. That might be kept by the owner of the property, or might be kept by you as part of your program requirements. And then we mentioned, as part of the documentation, there's a sample form for that record, which would, you know, capture information like when you did this, and a room-by-room evaluation. It's really recommended that you also take some pictures as part of that. So they provide you good documentation that that visual assessment was done, but it will also be the basis then if there are lead hazard reduction work that needs to be done, that it's going to be based on that, what the visual assessment identified. Oh, I think I flipped through a slide there. So you could choose, and Subpart M does not require it, you could choose to have a lead-based paint inspection be completed by a lead inspector or a risk assessor, and they would be determining whether there is lead-based paint present or not. And as we mentioned, they could be using an XRF machine, which is essentially sort of X-rays the substrate to determine whether any of those layers include lead-based paint. The other option would be to physically take samples, cuttings, scrapings, and send those off to a lab. That would give you the information if you chose to go to that level on determining, do I actually have lead paint here, or is this simply I've got some unstable non-lead paint on this. One of the things that we thought might be helpful for folks would be to understand what's done as part of a lead-based paint inspection. And so as part of a recently released resources and tools, there is a video on the lead-based paint inspection, and we provided a linkage for that. And then we wanted to just mention about the EPA regulations. So the lead-based paint inspections must follow the HUD and the EPA regulations, and then if you had any state or local regulations. And essentially, anytime we have multiple regulations, you're always going to be held to following the one that is the most restrictive. And so that might be state and local regulations as part of that. And so, for example, if we had a state that had adopted a more stringent requirement, you would need to follow that. So let's look at our standards on this. And so we have standards that are in place based on the type of surface or structure that we're dealing with. So for our paint standards, we have a separate standard for carpeted floors versus hard floors, and also a separate standard for interior windowsills. So these have somewhat recently at this point. They initially were put in place in 2020. There was a delay for EPA authorized states, but that is now passed also. So our new standards are in place, are 1 microgram per square foot or per gram or per liter on this. And so our testing standards on acceptable dust hazard levels are going to be based on these standards. And we have for bare soil, we have 2 separate standards. One is for where we're in a play area versus a non-play area. So obviously, if we've got an area, maybe playground equipment or an area where children are typically playing around that building, we're going to have a more stringent level of the 400 parts per million in place, as opposed to bare soil in a non-play area. And then, as we mentioned, testing of water is optional, but we do have standards in place for that also. As we mentioned, the EPA provides a list of lead-based paint. The URL that's listed below provides a list of authorized EPA state programs, and so we do recommend that you take a look at that and ensure whether your program actually is falling under one of the EPA authorized state programs, and where you particularly may have different standards. All right. So let's talk a little bit about, we kind of mentioned the different levels on this and said that our tenant-based rental assistance is going to fall under a visual assessment. Chris is going to be talking a little bit later that if we have a child that is identified with an elevated lead level, that we're going to have an environmental assessment, which is going to include a risk assessment. So let's talk a little bit about what a risk assessment is. So this specifically is going to be completed by someone who is certified as a risk assessor. So that's a separate certification from the visual assessment that we talked about earlier. And they're going to be looking to identify the lead-based paint hazards, where they exist, and then the nature and severity of those. So this includes both a visual inspection of all the deteriorated paint, evidence of dust, but also then looking at friction and impact surfaces, places like windowsills and floors. It would include dust samples on that. and kind of looking at how that unit is being used by that family that has a child under the age of 6. And again, there is a video that I think would be really helpful for folks to just visually walk you through an actual risk assessment process. So I've been mentioning about the use of an XRF machine. So it's an X-ray refractive fluorescence device, and essentially, as I mentioned, it's sort of X-raying the substrate that, and determining what those layers of materials are and whether they include lead. There again is a video that shows you that process, and again, I think it would be very useful for folks to see. So a lot of communities will have their own XRF devices, or they would have someone on contract who would be providing those services. And we'll talk a little bit later about the process when we have a child with an elevated blood level. And that might be one of the cases where we would be dealing with a risk assessor. So in that risk assessment report, that's going to be completed by our appropriately certified assessor, they're going to identify the hazards, provide the basis of that, the evidence of the XRF machine, testing printouts, or in the case that they sent samples off to a lab, they would have those results. But that's also going to include a lead hazard control plan. So they're going to not only identify those hazards, but also lay out these are the actions that would need to be taken to address these hazards that we've identified as part of that. So that's why you're going to hear about, as part of addressing when we have a child with an elevated lead level, that will be part of our action and process on that. There is a checklist, and so if you were reviewing that risk assessment report, in the toolkit there is a risk assessment report checklist, and that would kind of walk you through all the elements that need to be included in that, so as you were reviewing that report that had been submitted, you could use that as a resource. There also is a requirement then for providing notices. So the administering agency would need to provide a notice of lead hazard evaluation to the occupants. And the timing on this is that it needs to happen 15 days after those results have been determined. So at the point that you receive the risk assessment report that provides you with that information, the clock then begins ticking that you need to get that information out to owners and to occupants of those units. So we have a couple of options on how to do that. That notification for multifamily structures could be distributed to each household, or it could be posted in a central location. So maybe you have a high-rise building, or you've got buildings where they come through a central lobby, pick up their mail, and get the steps to go to their unit. That would be a central area where that could be posted. And that needs to be available for all residents, and that would include if they wanted to see the report on the evaluations on that. For single-family buildings, most generally, we're just going to see that report be provided directly to that homeowner. But keep in mind, if we have tenants that are occupying that unit, that tenant also needs to receive that notice. And there is a sample form for that, and we've provided a linkage for that. All right, so in closing on this section, the documentation we're going to expect to see in place for tenant-based rental assistance, we're generally going to be talking about a visual assessment, so we need to see that certification that the person who completed that evaluation has taken the training and has a certification in place, whether that's the grantee's staff, whether that is the property owner's staff, that would be part of that. If a visual assessment has been completed, we would need to see that the certification was in place for the person that conducted that, and the findings and the resolution as part of that. We also would want to make sure that the lead hazard evaluation notice, that we could see evidence that that notification was issued and the methodology that was used as part of that. All right, so before we jump into talking about the actual treatment, we're going to go ahead and take a 10-minute break. It's almost 2:30, let's say, that we'll be back in time and start at 2:40 Eastern Time. And so use your 10 minutes wisely. All right, welcome back, everybody. I hope you used your time wisely. I was searching for chocolate, and all I could find was healthy fruits and vegetables. Terrible. All right. So I wanted to pull up, before we move forward, I wanted to just pull up this chart again for Subpart M, because I think it really covers the key points that we're going to be talking about. So the important reminder here is that as Chris explained this morning, we have a disclosure requirement for all pre-1978 units, regardless of who's living there. But all the rest of our requirements under tenant-based rental assistance are going to be only triggered when we have that unit is occupied or it's going to be occupied by children under the age of 6. So, depending on your TBRA program and who was being assisted, beyond that disclosure, you may have a limited number of units that will require these additional steps that we're talking about on evaluation. So just as a reminder, we've been talking about the visual assessment is our level of evaluation that's required. And then we're going to move into talking about, once we have identified hazards, potential hazards with our visual assessment, then we're going to take on our lead hazard reduction. And in this case, we're going to be talking about doing paint stabilization. We'll be talking a little bit about what are safe work practices, and also about how we protect that occupant who's able to complete that work. So let's move back to our normal slides. But I think, if I was running a TBRA program, this might be something I would have printed out and kind of hanging within eyesight in my office, because it's a good way to sort of remind yourself of, okay, what applies here for this type of activity versus others. Here we go. All right. So we're going to now talk about, once we've completed that visual assessment and we've identified lead hazards, what that hazard reduction requirement would be under Subpart M. And so depending on the type of activity that we were undertaking, some projects will require much more stringent. For tenant-based rental assistance, we're going to be talking about paint stabilization. And so that's where we are going to be addressing just those areas where we have identified where we have, unstable paint surfaces, dust and debris damage to those surfaces that are presenting a potential lead hazard based on our visual assessment. Other activities and other subparts might require us to do a much more stringent, where we would be doing a more detailed evaluation, do testing of lead, and then be doing interim controls or abatement. And abatement's essentially our highest level of treatment, where we would be permanently eliminating lead-based paint hazards. And that might be that we were, removing those surfaces and replacing them, or we might be doing some kind of permanent mechanical encapsulation to be able to control that. So for tenant-based rental assistance, we're going to be talking about the more moderate paint stabilization, unless you, again, have chosen as part of your state or local requirements to require something further. So when we're doing paint stabilization, we're going to be addressing where we have any loose, unstable paint by removing that paint and other materials. We're going to repair any damage to that substrate itself, and then it's going to be painted with a new protective coat. This needs to be completed. It can't be just your maintenance worker handling that, the same person who did our visual assessment. It needs to be completed by a certified RRP contractor, and that's why we spent time earlier talking about how do I identify where contractors are available in my area, making sure that, if we're doing an RFP, RFQ, that's part of our selection criteria, that they show that they have certification, that they have trained workers, and it's going to be at the level that is required for the particular type of activity that they're undertaking. So paint stabilization is what we are going to be required to do. Now keep in mind, we need to make sure that those certifications are in that file and that we can demonstrate that we followed this requirement. So as part of our selecting contractors, we need to make sure that the person that is doing that is qualified to be able to do that. So as I mentioned, our bid would require that they submit that certification. We may be requiring them to provide references as part of that. Many programs will do, particularly where you were doing a lot of hazard reduction work, the program would simply have a pre-qualified list of lead contractors in place. For tenant-based rental assistance, that may be less of an issue. Also keep in mind, in this case, it may be the owner of the property that is going to be hiring that RRP certified contractor. So we need to make sure that those partners understand what the requirements are. And so thinking about as part of your oversight, is that something that you're going to require that you be able to review that to make sure that the contractor that they are hiring has the appropriate training and certification to be able to complete that work within these requirements. So contractors that are performing this RRP work that's going to be disturbing lead paint and are covered under the RRP rule, and that also includes not only just for residential units, but also would cover contractors that are working on child care facilities or preschools, and these are for units these are targeted units, so these are structures that were built prior to 1978. So we need to make sure that the firm has been certified by the EPA, or as we mentioned in some cases, we'll have an EPA authorized state program. And we would need to make sure that their renovators have been trained by a certified training provider. And so, we showed earlier that not only on the EPA website could you identify contractors that were already certified, but also would be able to identify where do we have approved training providers in your area. One of the other requirements is that an RRP contractor is required to provide the Renovate Right pamphlet, and that's a responsibility of the contractor. Provides a lot of really good information to the occupant owner of that unit. And keep in mind that there are penalties for that, for failure to provide that pamphlet. So if I'm going to be working to identify a certified renovator or a training program, we have provided sites, and again, you can plug in your zip code, your location, set a range that you feel is appropriate for that contractor pool to be identified, and this would give you information. We also did mention about, coordinating with other HUD-funded programs that are already working with the same types of certified contractors that we're needing for this work. We want to talk a little bit about some of the differences between the Lead Safe Housing Rule and the RRP program and how they apply to the implementation of your program. For some of our projects under the HUD rule, you're required to have a certified lead-based paint inspector or risk assessor. For tenant-based rental assistance, we've said that their standard is to have a visual assessment, and that has to be done by a certified visual assessor. Under the EPA rules, they have a much lower threshold on this, and they would allow the renovator to use a test kit, which they would use themselves on surfaces to try to determine whether it includes lead. We also have a requirement under the HUD rule that all workers and supervisors need to have completed the HUD-approved curriculum, making sure that they understand lead-safe work practices. There are some exceptions to this. We can have workers that are receiving on-the-job training, but they have to be supervised by a certified lead-based paint abatement supervisor who's also a certified renovator. And then under pre-renovation, we have a requirement. HUD is requiring a conformance with the EPA rule, which means that the EPA's pre-renovation pamphlet needs to be provided. As far as treatment, our treatment under the HUD lead-safe rule is going to depend on the level that's required under the subpart. And so we talked about, today we're talking about tenant-based rental assistance, which falls under Subpart M. And so our requirement is that we're going to be doing paint stabilization as part of that. And we have prohibited work practices, so things we will not allow to take place on that site. So the EPA has a shorter list. You can't use open flames, heat guns above a certain temperature, or a machine removal like a belt sander without a HEPA vac attachment to capture all of that. But in addition to that, HUD has 6 additional work practices. And so the reason we raise this is it's common to hire a contractor who maybe has only worked under the RRP rule and isn't familiar with the fact that we've got more stringent requirements on what's allowable as a safe work practice. And so you may need to point that out not only in a contract, but also maybe in a meeting, a pre-construction meeting with them to make sure that they all understand that. And then we mentioned earlier about the de minimis threshold under the HUD rule versus the EPA, and essentially the HUD de minimis standards are more stringent. Also, some key differences after the work has been completed. So all of our work under the Lead Safe Housing Rule, we are going to require that there be a third-party clearance testing that is done. So we would not allow the contractor themselves to do that, and this will need to follow the certified clearance testing protocol that we're going to be talking about in a minute. EPA rule is less stringent on this and allows them to do the verification themselves, and so is not requiring that they send off sampling and have a laboratory analyze the dust from that sample. And then again, HUD is concerned about making sure that everyone is notified in that process. So there's a requirement that occupants be notified. We talked earlier about when testing is done, but they also will be notifying them of work and clearance results as part of that process. We've mentioned about what our requirements are for tenant-based rental assistance. If you were doing abatement, we have a separate set of standards requiring a certified abatement contractor and supervisors. And as we mentioned, abatement is where we're permanently with at least a 20-year life expectancy of those treatments are going to control the paint and dust as part of that. So we might be removing it, as I said, or we might be using some mechanical attachment to encapsulate that remaining lead. So you've heard Chris talk about we may have properties that have been inspected and found to be lead-free. In this case, we may have abatement that's been done, but there still is lead remaining in the property, but it has been encapsulated with a 20-year life expectancy, so it's considered to be lead safe. All right, so as part of using our lead safe work practices, we need to make sure that those are documented. So first off, we need to make sure that the contractor that is doing the work understands what those requirements are, controlling the dust and debris, protecting not only their workers, but also we're going to be talking about protecting occupants and their belongings. And that usually is done not only with appropriate gear and appropriate work practices, but also trying to segregate off those work areas so that as we're doing work, things like your HVAC system aren't sucking up dust that's being created and distributing it across that house. And we'll be talking in a little more depth in a minute about sometimes when we may have to actually relocate the occupants of that unit while that is done. Once that work has been completed, we're going to be making sure that we've effectively cleaned up after that. So that's usually working wet and cleaning wet. We talked about the use of using a HEPA vac, which has the ability to capture more of that small particulate. And then specifically under the lead safe housing rule, we're going to use third-party clearance inspections and then provide notices. And there is, as we mentioned, links for identifying those RRP training providers that we've been kind of sampling throughout our slides. So some resources on this. There is a Safe Work Practices Renovate Right brochure that we talked about that we've provided a link for that. I also wanted to mention, and we'll mention this again at the end on the resources, there are interpretive guidance that take the overall guidance and give you case examples or more specifics. So, and these are set up based on the topic. So number S4 is talking about lead safe units. The R13 is about interim clearance. There's a link here. It'll also be included in the resources at the end. I really encourage you to spend a little time in investigating and reading those that would be applicable to your program. There is a checklist that can be used at the completion of that work on the lead hazard reduction activities that have been completed. And then when we talk about the HUD guidelines, Chapter 8 specifically is about resident protections and work site practices, which refer really closely to this. So I want to talk a little bit about, to finish up this section, about the occupants. So occupants and their belongings have to be protected while this lead hazard reduction is being done. And so that needs to be included in that statement of work that is being provided to the contractor. But then it really takes some pre-planning. So thinking about, we may need to store the residents' belongings. It may be that we can cordon off. Maybe we have done our visual assessment and we only have, maybe it's the bathroom and the kitchen, those areas where we talked about we tended to see lead-based paint used. If we're only doing hazard reduction work in those areas, we may be able to move things out of those work areas, store them in other parts of that unit that are not having work done on them, and be able to seal those off so they're going to stay and not be contaminated on site. But in other cases, we'll need to plan and be able to move those possessions out of the unit since we don't have a way to be able to protect them. The same would be true for tenants. Tenants may be required to vacate that unit for the day while we're completing that work and then getting our clearance completed to determine that that area is now free of hazards. Depending on the scope of work, that might mean that they need to be gone for more than a day. So maybe, it's a few days or a week, and we might be then, as part of our planning, include some relocation assistance. Maybe we're going to put them in a local hotel or motel, and we're going to be providing them with some meal vouchers on that. If we were going to have someone out of their unit for a longer period of time, then we're going to have to find a unit that would be more functionally equivalent, meaning that they would have, cooking and food storage facilities as part of that. But a lot of what we see is either, short-term, do the work quickly, have the clearance testing done, and then allow the tenant to return that same day, or it's a very short-term stay off-site in that. In some cases, we may, in a multifamily property, be able to, deal with a couple of units. Maybe you have a vacant unit that has been treated, and you can shift tenants into and then shift them back to the unit. But all of that would be something you'd want to plan on the front end of this. So relocation is required when that tenant has to be out of the unit, and we can't have them return until clearance is achieved, and we can't do that within an 8-hour day. Also, we sometimes have people say, well, we could leave the tenant in because we're restricting these work areas, but if part of your work includes essential parts of the unit, like kitchen or bathrooms, and that's going to go beyond an 8-hour workday, those folks are going to have to be relocated. Times that you would not have to relocate, if we're not disturbing paint, if we can complete this, including the clearance within that 8-hour work period, we might have a project where we were only addressing exterior items, and then we could, seal around windows and be able to allow those folks to stay safely within that unit. I will mention with elderly occupants that there is the ability to allow elderly occupants to remain on site after they have signed a consent form. And I'll just mention that there is interpretive guidance that goes into further detail on that. There's also a link for some additional guidance on relocation. So as part of that, we do have a checklist that kind of walks through verifying that all of the aspects of protecting the occupants and their possessions have been completed, and that may be documenting that they were, the occupant and their possessions were protected and they were able to remain on site, or they were relocated as part of that process. So we've got some forms to be able to document that part of the process. So really the documentation that we would expect to see at the completion of our treatment process was, first off and most importantly, making sure that we could document that that work was being completed by folks that had appropriate certification in place, not only the firm, but it also may apply for workers on that having training. Also being able to show our post-work checklists, showing that not only occupant protections and clearance have been completed on that, any of the documentation of your oversight on monitoring inspections, and those statements of work which would clearly call out for contracted work what the standards were, what the certification, calling out things like lead-safe practices, those sorts of things. All right, so let's jump into clearance, and I will, we just got a little bit to talk about here. We've kind of talked about this a little bit before. So our hazard reduction work is not considered to be completed until our clearance has been completed and they have passed the standards. So we've assured that we found that the remaining lead residue is now safely below those standards. We talked about the fact if we were doing abatement work that we would have to have a certified risk assessor performing the clearance testing on this. For non-abatement work, which is what we're generally going to be doing under tenant-based rental assistance, it could be, it probably generally is going to be a certified risk assessor, but it also could be a paint inspector or sampling technician if they have those in your area. And I'll just point out this no conflict of interest issue, that we want to make sure that the person that is completing that, we keep talking about a third party doing that clearance testing, we want to make sure that the person who is completing that clearance testing is not the examiner, not part of that process. And I'll just mention, if you have some kind of, let's say our lead work has been completed and there was going to be other work that is being completed before we're finished, we would do an interim clearance at the completion of the lead work, then allow the other contract work to be done, and then we would still do a final clearance at the end because we want to make sure that that additional work has not created through that work some kind of new hazard as part of that. So our clearance testing is not only going to be a visual assessment looking, again, for evidence of deteriorated paint, dust, other hazards, but it's also going to include dust sampling. So we're going to complete dust wipes. They're going to be sealed and sent off to a lab for testing. And you've got a kind of a visual here of our little samples being labeled and carefully put to be sent off to the lab. The lab is then going to be testing those results, interpreting those sample results, and providing a report on that. If our sample comes back and our report identifies that they have not brought those levels down to an acceptable level, then they're going to have to go back. Usually it's a matter of re-cleaning that area and then retesting. They'll need to keep doing that until they've brought the lead hazard down to an acceptable level. And again, we've got a video on this which I think is really helpful for folks in kind of seeing that process actually completed. So our clearance standards for carpeted, we have different standards for carpeted and hard floors versus our windowsills that we talked about earlier. And again, these are our dust wipe samples are going to be collected by our certified technician, sent off to the lab. And then the lab is going to either tell us that they have passed the test and we can consider this job to be completed, or we will be going back and doing more cleanup and more testing until we bring those hazards down to an acceptable level. So our documentation for our clearance process is making sure that we have documentation to show that the personnel who completed that clearance work had appropriate certification in place, and then that clearance report would be part of that. Chris, are there any questions that we need to try to address, or should we go right into the next section?
I think we can go into the next section, and
Great.
then if we have time, we can go back.
Turn this over to you.
Great, thank you. All right, let's talk about notification and what those requirements are after any paint stabilization, or what we're calling the work, is completed. Occupants are going to be required to receive a notice lead hazard reduction activities. This needs to be provided within 15 days of completion of the clearance. Here's a list of the required elements. Some of those I want to highlight are the types of treatment, where that work was done, an address and phone number for additional information, any identification of any lead-based paint that's remaining, any surfaces of lead hazards that might, where lead might have been, so that they're able to pay attention to that for ongoing maintenance and inspection requirements to check those. So here's a sample of a notice lead hazard reduction activity form. The sample includes all the regulatory requirements, and it has to be provided to the residents. And grantees can add more information. You can change the format, but you just can't delete any of the required items. And remember, this has to be provided within 15 days of achieving clearance for that work. There's a link here of where you can find this form if you don't already have one that you're using for your program. So here's a reminder of that documentation that's needed for the notification. We're going to have a copy of the lead hazard reduction notice. You want to check for all those required elements, the dates, the signatures, and then since new lead hazards and work was done, we do need to provide, the owner needs to provide a new disclosure notice at lease renewal. So you'll want to make sure there's an updated disclosure notice, look for dates, signatures, copies of the reports that were provided. So this is the notice that's given after any work was provided. If you do recall when we talked about, let me find our handout with the chart. There it is. No. Where's our summary chart? There we go. Okay. So if you do remember, you know, we were talking about evaluation. Visual assessment does not have a notice that needs to be attached to it. So you did not see us showing you a sample of a visual, you know, an example of documentation of doing a visual assessment, because there's no required type of notice, but it is a best practice that you do document that, and we do have some samples in the toolkit. And I know a lot of people had put in the chat, where's the toolkit? We do have some links later on in this training to get to the toolkit, but I also did put the toolkit link in the chat as well. So we're going to talk about ongoing maintenance and periodic reevaluation. This is done when, this is required when there was lead hazard control work completed. So unless all of the lead-based paint has been removed, the unit is required to be maintained to be lead safe, and it is subject to periodic reevaluations. Lead-based paint maintenance is not required when a lead inspection report indicates that there is no lead-based paint on the property, or if a lead-based paint clearance report indicates that all lead-based paint has been removed and that it's lead-free. Now remember, the type of evaluation we're doing for TBRA is a visual assessment, and the visual assessment is not telling you whether there's lead in the unit or not. It's only telling you if there's deteriorated paint. So a visual assessment is not going to be enough to tell you that the unit is lead-free. So you need to have additional documentation, such as a lead inspection report that shows that the unit is lead-free, that there's no lead in the unit. But we're going to talk about ongoing maintenance, because Les has talked you through if we did some lead hazard reduction work and then we passed clearance and we gave the notice lead hazard reduction activities. Now what do we do as the tenant continues to reside in this unit? So what are some other requirements? So this slide really shows the ongoing responsibility of ongoing maintenance and ongoing monitoring. So in general, the ongoing maintenance is about how to keep the unit lead safe. So if there's any remaining lead-based paint, we need to be aware of where that is, because lead-based paint itself is not dangerous. It's the dust or when it's deteriorated that's dangerous. So we want to be aware of where that is. If there's any changes, those new disclosure notices need to be provided. Records need to be maintained. And we want to make sure we're tracking the history of any inspections and any lead work that's being done. If there is any deteriorated paint that's identified during ongoing maintenance, it needs to be stabilized unless it's determined not to be lead-based paint. Any bare soil needs to be treated with interim controls. Safe work practices need to be followed. You need to be using properly trained RRP renovators, our RP certified staff. If it's determined that the paint that's found or reported during ongoing maintenance is above the de minimis levels on any repairs. Safe work practices need to be followed. If for some reason this unit had abatement, there might be encapsulations or enclosures, and so you want to be checking for any failed enclosures as well. All right, so ongoing maintenance, again, for units with children under 6. We are maintaining that the unit and the common areas are lead safe for continued occupancy. And when we talk about lead safe, we mean no deteriorated paint, lead paint, or failed hazard control methods. So who's responsible for this? Well, it's the owner who's responsible for ongoing maintenance. The program is responsible for communicating to the owner that this maintenance and ongoing responsibilities is required, and they should monitor to ensure that it's happening. So this includes a trained visual assessment. The visual assessment needs to happen every 12 months. We also need to ensure that the owner is responding to any identified deteriorated paint, and making sure that any work is being stabilized and being cleared by trained RRP workers. Clearance is being provided, any new notices are being provided, and then also written notice asking residents to report any deteriorated paint in the unit. So they're the first line. They're the ones that see if anything happens to the paint, and they should notify that to the owners as soon as possible. We mentioned here the visual assessments need to happen every 12 months. This can be the owner that does it. It can be somebody who works for the owner. They just need to be trained in that free online visual assessment training that's offered by HUD. Someone had asked, well, how long does that visual assessment training certification last for? Well, it lasts forever. There's no need to renew that annually or every couple of years, but it is a best practice for you to go back and look at that training and review the material every once in a while to see, there's some really good information, some examples of pictures and what chalking paint is, what flaking paint is, so it's a good a reminder, but it's not required to have that recertified every year, so there's no requirement for that. You just have to take the training once. And as we mentioned, ongoing maintenance is not required if lead-based paint was completely removed. So the documentation for ongoing maintenance, if there's every time the visual assessment is done every 12 months, we want to have some type of documentation of who did that, when it was done, did they notice anything, did it completely pass the inspection, if there's any new work that's done, information about that, clearance reports, if there was work was done, then we need to pass clearance, certification of all the personnel who worked on that, showing that they were RRP certified. Whoever did the clearance either needs to be a risk assessor or a paint lead inspector or a clearance technician, and then the updated disclosure notice. We'd want to have that in the file as well. Okay, so now we're going to do a really quick high-level review of the Lead Safe Housing Rule Amendment from 2017, and this addressed what do we need to do when a child with an elevated blood lead level is found in one of our units. So in this case, we are providing tenant-based rental assistance. We're giving a voucher to a family, and the unit that they are residing in is being funded with our TBRA program. And our program finds out that one of their children has an elevated blood lead level. So they've called you and they've said, oh my gosh, I just came from the doctor and they said my child has an elevated blood level. And so what do we as a program, and what do we need to communicate to our owners, our landlords, what needs to happen in order for us to be compliant with the Lead Safe Housing Rule? So I do have just a couple slides that's going to go over this. Les and I did train. We did a webinar on this in December, so it is available on the HUD Exchange. If this is not going to be enough information for you, if you haven't been trained in EBLL, I highly recommend that you go and listen to that webinar that we did before the new year. So EBLL stands for elevated blood lead level. Once a child has been reported with an EBLL, there are a number of steps that need to happen. They need to happen very quickly. First off, there needs to be a verification, then an environmental investigation needs to happen. We might not have used that term too often. It's actually a risk assessment done by a risk assessor that has a number of other elements tied to it. There's interviews, there's reviews of other areas in addition to the house the child or the unit the child resides in. They're looking at other places the child spends time during their day. So a much bigger review is part of this environmental investigation than just a risk assessment. There needs to be different types of verifications and notices, lots of different parties that need to be notified, the HUD field office, HUD headquarters, when this happens. And then if it's found that the unit that the child's residing in has caused the child to have an elevated blood level, then action is required in other assisted units in that property. And so this can be a little tricky with TBRA because your program might only be funding one household in that property, and you don't know what the other units are that are being funded. And so there needs to be some really good communication with the owner to try to figure out what are the other units, because we need to start to do risk assessments of these other units. We do have some resources that are connected to the toolkit on how to respond to a child with EBLL. So a couple key terms. We have our index unit. This is the unit where a child with the elevated blood level resides. That's considered our index unit. We have other coverage units. These are our federally assisted units in the property where a child under 6 is living or expected to live. And like I said, for TBRA, this can be a little tricky. So you need to find out from the owner what other units are federally assisted in this property. And then we have the designated party. We did mention this at the beginning of our training. The designated party is the responsible entity depending on what the action item is. And so for TBRA, it could be the grantee, it could be the public housing authority, it could be the property owner. It just depends on what the step is. And so we have this summary chart, and this really goes over all the steps. It's a good reference, so if you have been through EBLL training, this is a good reference to print out and have available. I would not rely on this for this to be your only information about EBLL, but I think it's really helpful because it goes through what's the step, what's the timing, and who needs to do it. This is, we're trying to figure out our designated party, so it tells you, step by step, who's responsible for doing what. So we start off with our verification. If we just get a phone call from the mom, the program, need to do that verification, and that can be a phone call to the health department or the doctor. It could be an email. We just need to get verification. That needs to be done as soon as possible. And then the owner is responsible for notifying HUD's Office of Lead Hazard Control and Healthy Homes, that's the headquarters, the HUD field office, and if it wasn't the health department that did the initial notification, they also need to notify the health department. Now, I don't know too many owners that know how to contact all these entities, so even though it is the owner's responsibility, I really think the grantee needs to be heavily involved in helping them with this notification to these 3 different entities. And that needs to be done within 5 business days after receiving the verification. Then we need to do the environmental investigation. Again, that's the grantee that's responsible for doing that. They're going to hire a risk assessor. It could also be done by the public health department. If you have a health department that has the capacity to undertake the environmental investigation, they can do that. If not, you hire a risk assessor, and the risk assessor will do an environmental investigation. That needs to be done within 15 calendar days after verification. Then after that environmental investigation is done, there needs to be a notification to the residents to let them know what was found in the unit, whether there was lead, whether the unit is the cause of the unit in the common areas is the cause of the EBLL or not. If it is the cause, then we need to be notifying our other coverage units that an elevated blood level child was identified in the property. We don't say who, we just say that it was identified and that we are going to be doing a risk assessment of your units. In addition, we need to be doing lead hazard control on that index unit within 30 calendar days after the environmental investigation result happened. Now, a lot of people ask us, What if lead was not found in the index unit? What if it was at grandma's house? Well, then the responsibility of the PJ or the grantee, the Public Housing Authority, is complete after we've given notification that the unit they're residing in is not the cause of EBLL. The grantee can assist the household by perhaps connecting them with the health department and other resources, but they don't have any ongoing responsibility. If the unit we're paying for was the cause of the EBLL, then we do need to continue on with these other responsibilities. So we're doing lead hazard control on that index unit. We're doing risk assessments on our other coverage units. Remember, those are the other federally assisted units in the property that have children under 6 living or expected to reside in those units. And that needs to be done within 30 to 60 calendar days. Again, that's the owner's responsibility, but the grantee needs to ensure this is happening. After all the work is being done, we need to have clearance, and then notice of the clearance are provided. You'll see there's some different days here depending on the number of units. So if you have larger or smaller properties, depends on the number of other coverage units to how quickly some of this work needs to be done. So just a couple things to look there. And then afterwards, notification to the field office that everything was conducted. That needs to be done within 10 business days. And then, as we mentioned before we got into EBLL, there is ongoing maintenance requirements. So that's a lot of information. That's a 3-hour training in 10 minutes. So please go back and look at the other resources that are available to you. So we do have training that's posted on the HUD Exchange. We have the link here to be able to get to that. Very excited about our videos that were released, I want to say like late fall this year. And one of the how-to videos is the family interview for an environmental investigation. So if you're not quite sure what's covered or how that's conducted, that would be a really great video for you to take a look at. It's not very long. It's like 6 to 8 minutes. And the woman on the left is an actual risk assessor, and so she talks through with the mom on the right what's going to happen, what they're going to do, that type of thing. So really good examples about that. Okay, and then documentation that we need to have for dealing with a child with an elevated level on one of our units, verification. This can be an email, it can be notes from a phone call, a copy of the environmental investigation report, the notifications to the residents that there was a child with EBLL in the property, as well as the notice to the index unit of the results of the EI. Risk assessments need to be conducted of all of our other coverage units, so we need to have the risk assessment report, we need to have a clearance report after clearance is done, we need to have copies of all the certifications of all the personnel who did the work, and a copy of the notice of lead hazard reduction activities. And again, here's a link to our toolkit that kind of walks you through what to do if you have a child with EBLL in your unit. So I think that ends my section here. Are there any questions that have come up that we should address now?
I think we should probably go ahead and finish out the balance of the slides, given that, and then we'll take the time at the end to revisit any of the answer or any of the questions.
Okay, I gave you control, so hopefully that's popped up.
It's working. Thank you. All right, so we've got 2 small sections to cover in this. And first, we're going to talk a little bit about program administration and monitoring. And a lot of this is looking at what are your responsibilities versus an owner or property owner. And I think kind of planning for making sure that you're going to have everything under control, essentially. So some key areas to try to take a look at. Thinking about having a knowledgeable staff And this, as we all know, is kind of an ongoing thing where making sure that you have capacity for this. That also, depending on how you're operating the program, may also lead into, subrecipients and making sure that they have appropriate staff, but then thinking about, since anytime we have any kind of lead reduction work, we're going to need to be working with a certified contractor, and so thinking about what's the pool of available contractors, and making sure that staff understand what needs to be communicated and how do we best communicate, I guess, to those contractors. So things like we talked about, that the differences between the lead safe housing rule and the RRP rule, so that there are additional work practices that are not allowed under the HUD rule beyond just the 3 that are included in the RRP rule. We have a higher standard on our clearance testing, on training and certification, those sorts of things. So thinking about how do we communicate that, and that would include things like if we're going through procurement, how will we make sure that those RFPs or RFQs include those requirements. Because with tenant-based rental assistance, some of this may be done by the owner, thinking about, how will we be able to ensure that the person the owner hires, or for things like if the owner's staff is going to be doing the visual assessment, making sure that we have evidence that their staff person has appropriate training. And maybe things like, if they have turnover in staff, they need to notify us and show that they still have that capacity in place. Also things like staff having basic knowledge about things like temporary relocation. And so we talked about the lead safe work practices and making sure that all work is being completed following lead safe work practices. Our staff needs to understand those practices, how we're going to be able to provide adequate oversight to make sure that that's being completed. But then on our occupant protections, making sure that there's some pre-planning that we talked about in determining, okay, for this unit and the scope of work that we need to do on our hazard reduction work, can that occupant stay in place? Do they need to be relocated? So the tenant is one part of that, and then the second part of that is thinking about their possessions, and are their possessions being adequately protected? And so making sure that that's communicated on the front end, but then also making sure that we're documenting that process has been followed and completed as planned for as part of this. And then you, as a program administrator, as like with everything else, have a responsibility on the due diligence on providing appropriate oversight and documentation to make sure that your projects are consistently following the requirements of the lead safe housing rule, along with the funding source that's being provided on that. And so thinking about what's my protocol going to be on monitoring, who will do it, what's my frequency on this, what's my standard going to be when I identify that there is an issue. So kind of laying out that program, I maybe calling it policies and procedures, but also that capacity planning as part of that, and then making sure it's actually implemented. So one of the challenges right up front is thinking about staffing on this, and then determining, are you as a grantee going to oversee this? Might you provide the funding to a subrecipient who has appropriate knowledge of the lead safe housing rule, has appropriate staffing, and what are your requirements on this? Are they going to oversee procurement? Are they going to be following the program guidelines that you've put in place? who's going to identify which projects actually trigger the lead safe housing rule. We looked at the earlier chart. We're saying, the disclosure, initial disclosure applies for everyone, but the rest of this protocol is going to apply on units that are occupied by a child under 6 or expected to. So, a way to determine of the assistance that I'm providing, which ones of these are triggering the full elements of the lead safe housing rule. So beyond, grantee versus subrecipient, also then this issue of, for these specific skills that are needed on things like the visual assessments, in this case for TBRA, for the hazard reduction treatment that's going to be completed, is that going to be completed by the owner, or will that be completed by the program? And so thinking about the procurement on that, obviously you as a grantee are probably triggering the federal procurement requirements, whereas an owner of a property is not, but we want to make sure that then that they hire someone who has the appropriate certifications in place. So making sure that we're going to plan for, if you as a grantee are going to need to procure some of this capacity, then getting that RFP, RFQ done in advance so that you're prepared when you actually need those skills. So we talked about visual assessments, determining whether it would be your staff, whether it would be the owner, getting that verification in place. And then when we are doing any hazard reduction work, we know that a third party is going to need to do the clearance testing. Is that something that you are going to be procuring and hiring, or will that be done by the owner? And then we not only talked about in sort of normal things of delivery of disclosures about inspections that have been done and then clearance results, but also particularly if we have a case where we have a child with an elevated blood lead level, we have some additional requirements on getting those notices out and needing to plan for that. And then making sure, of course, with temporary relocation that we have appropriate oversight on that. I'm going to pause for just a moment to get my plug in my headset, which is giving me a low battery signal. All right, I'm back in business. I'm plugged in and not going to run out of power. So we talked a little bit about, with tenant-based rental assistance, we have this issue where some things can be handled by the owner versus by the grantee themselves. So laying out some procedures to clarify who's going to be responsible for what, setting those standards so when we have an owner that's going to be not only procuring a contractor, but laying out what the the expected scope of work, the standards that they will need to work with, things like processing of contractor invoices, all of the documentation you need to have in place, is making sure that there's a plan for that and that everyone understands what those requirements would be. Thinking about some kind of third-party monitoring for the portion of the project that is being completed by owners and property managers, whether that's your staff or whether there's someone working on your behalf. We do want to point out that Chapter 24 of the CPD Monitoring Handbook, there is a specific checklist for the lead-safe housing rule. And we would recommend that you take a look at that really as part of the pre-planning to make sure that your program is going to be ready to be able to demonstrate compliance with the HUD's evaluation of your program. So in terms of documentation, we know that our focus are going to be targeted units of those pre-1978 units we need to make sure that if they are triggering the lead-safe housing rule, we talked about some of the exceptions, that we would have a lead-safe housing compliance file for not only overall functions of that program, but that also on a unit-by-unit basis, as we have the annual and a turnover evaluation, anytime we're doing reduction work, those notices that we talked about, and paired with that, either in that file or in an agency file, to be able to then demonstrate that, procurement had been followed and that we had firms that had the appropriate certification. And so there is a suggested lead-based paint document checklist, a couple of them, which I would suggest as a good starting point on this. There was one specific for tenant-based rental assistance, which you see listed at the bottom of this list, and that would, for Subpart M, would be the one, the go-to for you on this. So that may be helpful in kind of pre-planning what documentation do I need to have in place, and then think about who's responsible for capturing each of those elements, when is it going to be done, and how do we provide enough oversight to make sure that it is actually being done so that there aren't any surprises sort of late in the process. So before we go to questions, I want to kind of close out by looking at some of the available resources. And we've been calling out a bunch of these as we go along, but I think knowing where to find them and where to look for further things is going to be important. So there is a landing page, at least that's what I call it, on the HUD Exchange. So sort of everything lead-based paint would be found at this page, and we provided the web address at the bottom of this. And so I would think that's something you probably want to locate and make a favorite so that you can quickly get to that. And I want to point out then some of the things that you would find on this page. So we had questions about where do I find the toolkit? And so as we've been talking about, for each of these sort of major functions and for the different subparts, there are toolkits that provide sample forms and further guidance that would be useful in putting together how you're going to implement your program. So you'll see, if you can see that small on your screen, there is a Subpart M, Tenant-Based Rental Assistance tab on the toolkit. And so if we were to go to that, then there are some tools that are specific to the tenant-based rental assistance program. But we also have tabs that are related to, for instance, there's a dealing with reporting where we have a child with an elevated blood lead level, which Chris was talking about earlier. So a lot of useful tools where you don't have to reinvent the wheel, that there's a tool that's been created. In some of those cases, you may want to modify it specifically for your program design, but these could be really helpful for you. Also, we've been talking about, I think it's really useful, I think most folks, you can hear us talk about things and show you verbiage, but on a lot of things, it really helps to see what we're talking about. And so we've talked about a number of these videos about inspections and risk assessors. Chris pointed out one that's an interview with the investigation for a child with an elevated blood level. I think these will be really a helpful pairing with the trainings that we've made available to you, just to have a visual reference and understand what happens in some of these key steps along the way. So I really encourage you to take a look at those if you have not already. Then a couple of the sort of key resources. So the HUD guidelines, and we just tend to call them the HUD guidelines as opposed to the full name for evaluation and control of lead-based paint hazards in housing. We've been calling out some of the chapters along the way. So there are in-depth chapters on each one of these topics. This is the link for that. And this is really kind of the how-to further details on any of these topics This is a really good reference tool not only for you, but also might be used by owners, property managers, others. And so take a look at this, and you may want to share that resource with some of the partners that you're working with. So I'll also mention many of you are probably already registered on the HUD Exchange, but you can also register or include in your preferences the Lead Safe Housing and Healthy Homes mailing list, which would mean that as there are future training, as there's new guidance, that you would be notified of these resources. And so we've provided the link to go to the HUD Exchange and then sign up, list out your preferences to subscribe to any email updates for that. So some of you may already be registered but simply need to update. Others, you may want to subscribe, register with the HUD Exchange, and then lay out those preferences. And you can see, for example, that we have, they're clicking on the tab for Lead Safe Housing and Healthy Homes would then have you, the system is going to know, oh, you want to be notified about new information as it's coming out. Just a little laundry list of some of these. So the lead regulations themselves, postings of where the Lead Safe Housing Rule trainings are. We've provided a number of EPA links along the way. This is for the main EPA lead page on this. We mentioned the interpretive guidance for the Lead Safe Housing Rule, and that these are laid out topic by topic. Very useful reference tool. Here's the lead-based paint that we referenced earlier, and then as the landing page, and the toolkit that we mentioned before, the videos. And then there was a public housing notice that was issued that particularly for public housing provides some additional guidance. Now, I want to point out the bottom here. So, we're going to have, we have a little time left today for additional questions, but we also have an office hour session tomorrow. After that point, this is an important email. So if, as you have questions that come up related to the lead regulations, this is your email to submit questions and get assistance from the Office of Lead Hazard and Healthy Homes office. So I would hold on to that for future use. With that, I think we'll open up. Chris, anything that you think we need to talk about? Oh, before we do that, let me just mention, as we said, our office hour session is tomorrow. And there is an exercise that you're asked to review in advance of that. That was included in the link with the materials for today. And so we will start our session tomorrow by going over that exercise, help kind of reinforce some of the things that we were covering today, and then we'll spend the rest of the time answering any new questions and also reviewing some of those sort of common areas where we want to make sure everybody's really clear on the topics.
There's a lot of different questions that came in as we were going over different areas. I think one that might be helpful for everybody here, somebody was, when we were talking about a visual assessment is what's required, and then there were a couple slides that talked about a risk assessment, and so someone was just confused because they said, well, I know the visual assessment needs to be done at unit turnover, but when do I do a risk assessment? And so under Subpart M, which is what we talked about today, a risk assessment would be required if there's a confirmed EBLL child. So remember, we would do an environmental investigation, which a risk assessment is part of an environmental investigation of the index unit, and then the other coverage units would require a risk assessment if the index unit ends up being the unit that is causing the child to have EBLL. So I thought that clarification might be helpful. Let's see. Somebody was asking about, well, does the PHA relocate the tenants while the lead hazard control is taking place? And Bruce had let the questioner know, well, the owner is really responsible for temporary relocation if it's required, but often hazard control can be done without relocation. But each project, as you mentioned, Les, when you were going over this, really needs to be evaluated to determine how to address the resident protection.
And I think the key there is thinking about that in advance.
Let's see. We covered a lot of these. I'm trying to see if anything new has come in. If you have a question, Les and I are here for a couple more minutes. Please go ahead and type it in the Q&As. Les, I don't know if there's anything you had seen earlier that you responded to that would be helpful to review now.
I'm kind of guessing that people after almost 3 hours
are tired.
are tired and a little brain dead, and maybe we kind of review those in tomorrow's
sure.
session.
Yeah, we can do that. They're all ready to search for some chocolate, too.
I don't know if anyone heard at one point while I was presenting, there was a cat meowing.
We could not hear the kitty.
Oh, good. And it had actually identified or brought me a bumblebee.
Oh, no.
Which, when I turned things over to you, I then put back outside. But
good.
That was kind of an interesting experience.
Yeah, and Sharita, thank you. She had posted again in the chat where the materials are provided. So you can click on that link. For some reason you didn't get it in the email today. You can click on that link and that goes to where the materials are provided as well as the exercise that we're going to go over tomorrow. So tomorrow's format will review the answers to the exercise. So hopefully you have some time this afternoon or tomorrow morning to work on that. And then we'll go over any new questions and answers that come in during that session, and then we'll go over questions and answers that came in today. So Les, someone's asking, where can we find the inspector training and the risk assessor training? I know we have a slide in the middle of your session, right?
Yeah.
Where people can find that.
The visual, let's see if I can identify that slide quickly. It's slide 48, and Chris, I don't know, maybe I have control.
I think you still have control.
All right. Yeah. So here's the link for the online training and certification. And then for the risk assessor.
65 maybe?
We'll try that.
Yep.
Yeah, which would identify not only folks that are already certified, but then also training programs. Yeah,
and then one of the handouts too, Les, maybe the worker handout, I think that on the second page, is that the second page? Yeah, if you scroll down, I guess we have to scroll down ourselves, right? Go back to the second page. I think this provides some more information. Nope, it just gives you the regulatory sites. But the slide that Les was showing from that EPA website is where you can go and find training providers to be able to become. This is RRP, but I'm pretty sure there's risk assessment too on the.
Yeah, I think there is
on the EPA website. Okay. All right. Well, I don't see any more questions. The person that asked that, if that wasn't enough for you, come back tomorrow and we will ask more questions about it, and we'll try to help you out tomorrow as well.
That'll work. All right. So we're giving you a few minutes back of your life, which you could use to look at your exercise for tomorrow. So we hope you'll join us tomorrow, and hopefully this training has been helpful for you. Thanks, everybody.
Thanks. Bye-bye.